Okay, so we have a lovely lady here, and as you can see, we have a little lump on the left lower back area, right here, almost mid back right there, and it hurts as well.
Much as possible.
So the fact that it hurts means it could be a neurofibroma, and I'm just palpating, and it's right there, and this is the boundary of it. So we'll define the boundary, and then get a horizontal incision. You can almost see the relaxed skin tension lines. These are relaxed skin tension lines. We'll follow that for the incision, and then go dissecting and find it everywhere, take it out with no pain. That's our goal. Zero pain. We really don't have any pain tolerance here. Zero. So we are ready to rock and roll. Usually these are lipomas, they're well circumscribed, but this is not. This is literally is like an oval shaped thing, and it is not well rounded, well circumscribed, and that's why I don't think it is a lipoma. Usually they're like perfectly round, or they're like a pancake. So we'll find out. We're ready for anything that's there. Okay, so we're done injecting. I want to just show exactly how to do it here for the students. If you come in nearby, please. So first you demarcate the boundary to get an idea like how big it is. Then you look for the relaxed skin tension lines. If you look very closely here, see these right there? These are the relaxed skin tension lines that tells you that horizontally is the direction to go right there. So then I mark the incision, which would be an ideal long incision, but then I palpated to see what is the smallest one I can get away with. So this was the smallest one I can get away with. Then you start injecting with small needle. Make sure you have sodium bicarbonate with your local so you don't sting the patient. Patient is awake, by the way. So then you go in the incision. Once you've done that, then you go fanning in all directions. And once you've done that, do enough so when you raise the flap, you have no problem. Then you have to go find the underneath it as well. But underneath, you don't want to get into the chest, obviously. So you pinch it, and you can tell, and you lift it up a little. Now you know you're higher up, and then with the needle, you can go underneath it and literally do hydro dissection, pushing a lot of, I almost put like, I don't know, 5 or 7 cc's underneath, and then lift it up. So that makes it easier, because then your dissection will be a lot easier, less, bleeding or anything. So that's what we'll do. Perfect. Okay, so we are closing now, and when you close, it's important to keep in mind the eventual end result, where the wound will always try to separate and widen with time. So the closer you can bring it, the better, especially in a high stress area like the back. So if you come in here, take a look. See the deep bites? The deep bite from here to here? That deep bite from here to here pulled it together. So this is like a raised bump. Looks weird and oh, it looks awful. No, but that's on purpose. With time, it'll flatten and relax, and then there should be no stress on this incision lines, and it should heal really well. That's the goal. Thank you.